crazy. I appreciate you hopping on this call.
Yeah, no problem. Of course, I was looking forward to the opportunity to
Yeah.
be on the show. I know Karan did it; it looked amazing. I know I don't have the luxury to be in the studio, at your spot, but
Yeah.
this will have to do because I mean it's so timely. But I mean I know you do dope work, so yeah.
No, I appreciate that. And yeah, I actually like this virtual interviews because it's
Mhm.
so quick and it's easy. So
That's true. It is quick. You just record the Zoom. It's real easy. You take
yeah,
the file, you do what you got to do with it, and there you go.
exactly. So yeah, so first I have a few questions for you.
Yeah.
Just wanted to ask you, I've been following your Instagram page, seeing your interviews lately about, the coronavirus. And yeah, so my first question for you, for me personally, this is something that I thought about. You can't really go anywhere unless it's like a necessity. Everything's been kind of shut down. Um, but I feel like I want to ask you, what do you think is the biggest fear, I guess, being Black during a pandemic? Um,
Mm.
because I saw your video about, why Black men are afraid to wear the mask.
Mhm.
And then I've seen one case, a Black man got kind of like handcuffed for no reason. And I think he was trying to test the homeless people for the coronavirus, and he wouldn't have gotten off if it wasn't for his wife that showed his ID. So it's just like stuff like that. I want to ask, what do you think is like the biggest fear for Black people right now during the pandemic?
Yeah, that's a great question. I mean, I think the biggest fear for Black people during a pandemic is having a heightened awareness and an increase that our bodies are devalued, that our lives simply don't matter. So whether or not we are being stopped by the police because we are actually following orders and directives of law enforcement and state orders and wearing personal protective equipment and being stopped, like the physician that you mentioned who was loading up his vehicle and putting stuff there for people to pick up and going to actually help test homeless people, actually putting his life on the line to help others. And here he is being profiled in front of his own home. So I think the biggest fear is the increasing awareness that our bodies are devalued. And that extends to the fact that we call in from a hotline and they see the zip code of where we're calling from, and instantly, all of a sudden, they don't want to give us the same care. Or they can potentially tell by how we speak, they perceive that we're Black. And then we actually go in to get care and they send us home. Or we know what happens when we interact with physicians and healthcare providers. They talk to us instead of talking with us. All of these things lead to a devaluing where we are more likely to be sent home. We are less likely to be given the same care, the same testing, the same type of medication that others are getting. And it leads to a higher likelihood that people like us will die. And when you enter a pandemic, the big thing people don't realize is that inequality is exacerbated during a pandemic. It's not decreased. Black people are acutely aware of that. And so we're worried going outside on a normal day. So we're even more worried going out during a pandemic. And I think that's also heightened as well because social distancing is a privilege. So while, some of us get to stay in the house and, telework and make cookies and brownies with our kids and complain about having to help our kids with homework, there are people who look just like us who are going out who don't have those same luxuries. They are forced now to still take the bus on a limited schedule. They are forced to take the train. They are forced to go bag someone else's groceries and come across hundreds of people every single day that's exposing them to the virus, working for pennies on the dollar, not getting hazard pay, not getting paid leave. And so all of these things during the pandemic, the inequalities that normally exist collide on the bodies of Black people. And I think most of us are aware of that.
Mm. Yeah, that's a great answer. So my other question for you is, why, like compared to the other countries, first it was like Italy was really massive with like the deaths and the cases, and then we just skyrocketed, we passed everybody.
Right.
Why are we like having such a hard time? We're supposed to be the best country, number one country, and just looking at what's going on with the funding for the small businesses, it's just like today has been crazy. So why is everything just not, why don't we have everything together compared to other countries?
Yeah, that's another great question. You asked really good questions. I read something today that was really deep. It said, it said, is the United States really the wealthiest country in the world, or are we simply a third world country that wears makeup? And I felt like that statement was very profound because I'll kind of break down the stats and talk through it. So the first big thing is that the United States spends more money on healthcare than any other country in the world. In fact, we spend 25% more per capita on healthcare than any other country in the world. Switzerland is second, not even close. A lot of this has to do with the fact that we don't have universal healthcare. So per capita, because some people are like, oh, well, of course, the United States spends more. We have more people. No, per capita means like per person, like per expenditure. So even if we take into account the size of our healthcare system and the number of people, we are still spending 25% more. There was a really deep report that came out of Johns Hopkins. Ironically, it's been one of the same institutions that have actually, vilified and marginalized our people historically. But this particular report was a report where they put together health experts from around the world, and they did a health report in terms of how prepared were countries for pandemics and security risk, like what we're facing now. This report was done of 195 countries. The United States ranked number 1 on the list. Now, interestingly, the United States only ranked 84%. So 84 out of 100, I'm a professor. That's just a B. That's just average, right? So to be number 1 and be a B, I mean, like, what does that really mean? Right. But what really started to see the inequities is that the United States was number 1 in finances, but it had only 66% approval as it related to healthcare access. What that means is that we were actually lower than countries in Europe, Asia, and Africa on that metric. In fact, in some of the metrics, we were lower than Congo and Liberia in terms of responding to pandemics, because in Africa, as well as in certain parts of Asia like Taiwan and South Korea, the reason why they're performing so well with coronavirus is because they learned from Ebola. They learned from the avian flu. They learned from H1N1. Right. And the United States supposedly did as well. So I'll walk through this history and then kind of get to the main point. Yeah. So there have been, pandemics throughout time. The recent one that people keep comparing it to is the Spanish flu. And I think we have to be very conscious of the fact that when we name these viruses, we name them after the place supposedly where it came from. And this is what Trump is actually trying to do. So that's why it's really important to call it COVID-19 for 2019, right? The year 2019. There have been other coronaviruses. Coronaviruses are found in bats. I mean, they recently discovered 6 new ones. So I say all that to say a lot of scientists and experts actually think this might be the preseason of pandemics, which is scary to think about, as to your point, as little prepared as we've been. So this history is this. We had the Spanish flu, 1918. In the 1950s, I think it was around 1957 or so, we had a large flu. That actually led to us getting the flu vaccine that we have today. So that just goes to show you it takes a long time for vaccines to build up. This logic that all of a sudden we're close to a vaccine. No, we're not. We're actually not close to a vaccine. We are in the testing phases of a vaccine. And as a scientist, I can tell you that what that means is we are starting to test it, but it has to go through a lot of rounds. We have to have what's called a randomized control trial. We call them RCTs. What that means is you take 2 groups of people, say 100 people and 100 people. You give one group some type of medication and you give the other group a placebo or something else, and you compare the two to see how it happens. Some of the studies that are coming out on the medication, hydroxychloroquine, that Trump is really pushing, which his family actually has a stake in that, by the way, but he's really pushing that. Some studies coming out of Asia actually show that that drug, all it simply does is improve symptoms of people who have COVID-19. You could take Tamiflu and other sort of over-the-counter drugs for the flu, and your symptoms will improve eventually. So that's not going to be the end-all be-all. But we had the flu in the 1950s. Fast forward to 2009. All right, it was some other things in the middle, like in the 70s, Ebola started really hitting, and we had to deal with that, particularly at the motherland. But in 2009, during the Great Recession, H1N1 hit. Okay. A lot of people died from that. And it was kind of mixed up with the flu originally, similar to what coronavirus was. Like at first people were like, oh my gosh, this is just like a horrible flu. Like, what the heck is this, right? Because the symptoms present similarly. But H1N1 was a different strand. Well, at the time, the Obama administration wasn't fully prepared for that. And it impacted us greatly, even though we didn't frame it in the same way because we were in the middle of a recession. We fast forward to 2014. President Obama put in place a pandemic response team. Okay, that was housed in the National Security Council, meaning they pretty much talked to him every day, every week, and briefed him on what was happening with outbreaks and viruses around the world. When Ebola hit in 2014 and it was ransacking Western and Central Africa, only 10 people got to the United States that had Ebola. And I think a lot of people remember that because that was another example of where Black bodies didn't matter, because they sure enough let that brother die in Texas. Yeah. And so we have to be very, clear about that we have these vivid examples of everyone not being treated the same. With that being said, only 10 people came into the United States. And Trump, when he got in office, part of his objective was to dismantle everything that Obama did. So he actually pulled the funding and actually replaced that unit. And I think that's one of the main reasons why we are in this situation that we are today. Like, yes, I think Trump closed down the borders with China, with people coming in. But honestly, by that time, millions of people had already came in. Millions of people come to the United States every single day. So that's kind of part of that. So the point is, even though we spend a lot of money on healthcare is not equitable for everyone. And something that I've been saying a lot is that when you look at coronavirus, it's a full opportunity virus, right? I mean, you got Kevin Durant getting it, you got Idris Elba getting it, you got Chris Cuomo getting it, you got the president of Harvard getting it, you got Boris Johnson in the UK getting it, you got Prince Charles of Wales getting it. I mean, it doesn't discriminate.
Right.
But our healthcare system does discriminate, and our society does discriminate. So in black neighborhoods, black neighborhoods are less likely to have access to healthcare, meaning they're less likely to have hospitals, less likely to have urgent care clinics, less likely to have pharmacies. So what that means is when people do go to the doctor and they've dealt with all the stuff we deal with there, and say they get out of that, they're given a prescription, they try to get it filled near their home, the pharmacy might take days before they get the prescription. Well, 48 to 72 hours with a virus like this can mean life and death. And they're finding hundreds and actually thousands of people around the country now in their homes dead, where they've been turned away because we don't have adequate testing. They were sent home because they have a pre-existing health condition. That's another type of factor that plays a role, that they're sending our people home. And we know we're more likely to have pre-existing health conditions because of the structural conditions of our neighborhoods, lack of healthy food options, lack of places to exercise, all of these sort of things that we know matter. So even though the United States spends a lot of money on healthcare, and if you make a lot of money and you have good health insurance, yeah, you're gonna more or less be fine. But that is not the reality of a lot of Americans. And the people currently out there putting their lives on the line, and not just frontline workers like healthcare providers, firefighters, and police officers who are putting their, I mean, they pretty much put their lives on the line almost every day. But, cashiers, grocery store workers, people who work at restaurants, people delivering food, bus and transit drivers. Black people represent about 20 to 25% of people in these occupations. In some occupations like bus drivers, 30% in the United States. And so you have like a brother up in the Midwest who, when he got off the bus, he made a video and was like, this woman got on the bus coughing. I can't believe she was doing that. Like he was really upset. A week later, he was dead. And so these are the types of things that we're talking about. And when it comes to personal protective equipment, you know what? Affluent people have their personal protective equipment. Like where I work, we have an abundance of it that we've actually been giving away to hospitals, like Howard University Hospital, for example, that we perceive to be in an area that might be more in need. So we can make those type of decisions. But, I hope that that's a long answer, but an important answer about people like, oh yeah, but we spend the most money on healthcare. We're the most affluent country in the world. Affluent to whom? Because for people who look like me and you, oftentimes that's not the reality that we're living in America.
Yeah. Wow. Dang, that was deep. It's crazy though. And then I wanted, next question for you is, I talked to a friend about this, couple of people about, our eating habits. I don't know if it's, just people in general, but I saw your percentage. It's like 74% of Black people are most likely to get the coronavirus and die from it.
Right.
Do you think that's an eating thing? Like, are we eating wrong, or why is that? Curious about that.
Yeah, I mean, look, obviously food plays a big role in what's going on. But I think, again, it's structural. So let me lay it out. If you have $10 in your pocket and you're trying to feed a family of 4, are you going to go to the Whole Foods that doesn't exist in your neighborhood or the McDonald's on the corner? You'll probably go to the McDonald's, right? Because the Whole Foods doesn't even exist. Like, I mean, where is it? I mean, like even in the areas in Prince George's County where we happen to frequent, the people here had to fight for the Wegmans. And so part of it, when you look at it, even in an affluent area, how many healthy food option places are there? And so it's not about social class with Black people. Unfortunately, it's about the racial composition of neighborhoods. So a lack of healthy food options drives what we eat. So, you know, people are like, oh, well, if we wasn't setting up having these, you know, Popeyes versus Chick-fil-A challenges, you know what? The line for Chick-fil-A long in white neighborhoods too. Like, I don't want to hear that. The difference is they have a Trader Joe's or they have a Whole Foods right behind Chick-fil-A. So yeah, they might get Chick-fil-A once a day. And in a grand scheme, Chick-fil-A, I mean, yeah, it's fast food. It's not like you eat Popeyes or Wendy's or McDonald's. I mean, so we have to be realistic about that. But you know what? You pay a premium for Chick-fil-A. Because when I go to Chick-fil-A, I'm like, man, we should have just went to Carrabba's. Like, I mean, we just spent a whole bunch of money for Chick-fil-A. Like, we could have, you know, we could have went somewhere else for what we just spent to buy our kids chicken sandwiches at Chick-fil-A. Whereas at McDonald's, my whole family can eat for $10. Like, it's just not even a question. We get 2 large fries, we get some hamburgers, some cheeseburgers, and 2 large sweet teas get refills. Oh, we might be walking out with some change. That is the reality of Black people. So when I was at UC Berkeley working there, I worked with the Robert Wood Johnson Foundation, which is a large health policy organization. And one of the big things that we were working on were studies trying to gauge people's health behaviors. And the analogy I just gave was one of them, where what we started doing was we started doing studies where, and of course we see this across the country now, right? Where you walk into a place and they have the calories on the menu. Well, you know, people like me and you might look at the menu, I might say, oh, 700 calories? Okay, do that. 400 calories? Okay, I'll do that. You know what? It's a privilege to make that selection because I'm not worried about the price of either item. People who are worried about the price, they don't care about the calories because they just need food. So part of what the point is, people oftentimes eat what's close to them. White people eat what's close to them. Affluent people eat what's close to them. Black people eat what's close to them. Low income people eat what's close to them. That is what it's about because money is driving our food purchases. Like, who can afford to go to Whole Foods? Who can afford to go to Wegmans? Like, I mean, Wegmans, look, you walk in Wegmans, it looks good. You can go get your, you know, they got the little buffet bars. You can get sushi if you want to. You can get all kind of stuff. But you know what? You're going to pay for it compared to going to another grocery store where you might end up paying less money. So I say all that to say that structure drives people's eating habits. With that being said, though, of course, there's some personal responsibility in this, and we have to try to make better decisions when we can and try to make healthier decisions about our food. But these lack of healthy food options, the lack of places to engage in physical activity, the fact that a lot of us are working 40, 50, 60 hours a week just trying to put food on the table, making a little bit of money, is primarily what's driving what's happening to our bodies. And it's a key concept that's important for people. It's called epigenetics, okay? Essentially what epigenetics says is that our environment helps to manipulate our genetics. I think one of the best examples is Flint, Michigan. Everybody knows about the Flint water crisis, right? One of the things people don't know about all that lead is that Baltimore almost has a similar level of lead as Flint, Michigan does. And what does lead do? Not only does it manipulate your insides and starts to impact your health outcomes currently and later in life, but in the immediate time, it starts to directly impact your decision-making, your cognitive functioning, your performance on academic tests. So this is all structural. We haven't even got to what people eat. People are just drinking water from their house. So I say all that to say, I think we place an overemphasis on things we see, which is somebody walking out of Popeyes. Again, I'm from Tennessee. I see a lot of white people eating Popeyes too. We just don't frame it that way. I've seen a lot of white people outside during this time too. Some of them have been staying in either. We just don't frame it that way because even the narrative, even for Black people, we tend to blame ourselves for certain behaviors that everybody is doing. But we're blaming ourselves oftentimes because we know it's going to hit us harder. We just don't always fully understand that to be able to articulate it in a particular way. The structure is missing because it's hard to see structure. Like, unless you've lived in a lot of different neighborhoods like I have and studied it, you really don't see the drastic differences to ride right down the street. And you can see it in Prince George's County, right? All people got to do is ride down in Prince George's County. You go from, you know, nice $500,000 homes to you like, what the heck just happened here? You know, you could ride down 202. I mean, you ride down 202 and 214 and instantly you're like, wow, this is like a whole different area. The access to healthy eating changes, density changes. Like, it's a lot of things that changes. It's like, if I actually wanted to engage in physical activity in this space, where would I do it at? Like, there's not even anywhere to do it. And so I think we have to be conscious of that. And then accordingly, what we have to do is to demand from the elected officials that we put in office, we cast those votes for those people, to demand what we need from them. And that's important, because elections aren't simply about when we elect them on voting day. It's more about holding them accountable from one election to the next election. And I think we have to do a better job of that.
Yeah, definitely. All right, those are my main questions. I appreciate it. Appreciate, your knowledge and your information. I feel like I've learned a lot.
Well, look, I appreciate it. I mean, I think we're in one of those moments where we can, and in fact, I just had, of course, I had these pieces come out on COVID-19, but one of my colleagues at Brookings, Andre Perry, we just had a piece come out on reparations. And, it's actually reparations or Emancipation Day in DC. One of the big things people don't know about emancipation in DC, it's actually a screwed up history. When they freed 3,000 slaves, which is about like a year before the Emancipation Proclamation, because Abe Lincoln was able to do something locally before he was able to take it nationally. When those 3,000 Black Americans were freed from enslavement, their slave owners actually got reparations for lost property. That lost property being the bodies of Black people. So part of this historical knowledge we have about the devaluing of Black bodies simply isn't there. In 1860, Black enslaved people were worth $3 billion. $1860, right? Black Americans were worth more than the railroads and the factories. So we have to realize our value. That part of trying to devalue us is to make us not realize how valuable we actually are. And so that's happening in this moment, where the United States has another opportunity to atone for what's happening now and what's happened in the past. And, I'm not super confident that's going to happen, but I think as a people, we can demand it. We can become conscious of it, because again, another pandemic is going to happen. Another crisis is going to happen. And the most marginalized and oppressed of us who look like us are going to be on the outside looking in of opportunities to make sure that we survive.
Wow. Yeah, that's scary. Just thinking about that.
Yeah, it's spooky. It's spooky. I mean, I always think like knowledge is power. It's like, you have a hit where it's like, oh, that was deep. Okay, I got to process that. And then it's like, okay, let's come to terms with it. And then we use that knowledge for power. Okay, what do we do with it? So we speak truth to power, and we use the knowledge for power. Like, okay, what can we do about it? Okay, now I have a different lens by which to think about who I'm putting in office. I now have a different lens to think carefully about what they say. Like, I'll give you a good example. I mean, obviously, Joe Biden is going to be the Democratic nominee. I was listening to this interview, or I guess conversation he was having with Bernie Sanders. It was really one a conversation. They were really just like talking at each other, but not really like to each other. Right. It was, they were like, it was strange. But one of the things Joe Biden said, he said, look, we really need to think about student loan forgiveness, which is one of the big reparations policies that we've been pushing, that I've been pushing, and others. And he said something very important. He said, and we need to make sure we include historically Black colleges and universities who are more likely to be hit with private loans. Like, we need to make sure we include private HBCUs. Right. That was so significant. Why? Because when they finally pass legislation on student loans, which is going to happen, it could actually happen sooner than people think if this pandemic keeps going on longer. Right. They're going to simply do this with federal loans, which means Black people are more likely to be steered toward private loans with higher interest rates, which means we're going to be on the outside looking in of policies that we should be at the center of. So we have to be conscious of the language. So the knowledge that we have when we share, information, knowledge, and we share a discourse and words actually helps us to have an ear to say, oh, that was on point, or an ear to say, that's screwed up. Like, when I hear stuff, because I do work in the policy space, we'll be watching TV in my house, and I'm like, that was one of the most screwed up things I've ever heard in my life. And my family's like, what? Didn't sound that bad. I'm like, it was horrible, and this is why. And so part of it is helping people to understand a discourse that when these politicians are talking, they're using a slightly different coded language. Yeah. And we need to learn that language so we can protect ourselves.
Yeah, no, that's big. Definitely the language. That's huge, because I feel like a lot of us, especially like millennials and the younger generation, starting to watch the news now. So especially, getting ready to vote, we need to understand what what they're talking about. So
I mean, without a doubt, and I mean, you got to know what they're talking about. And, that's the age, right? Like millennials, particularly like middle and older millennials. I mean, that's the age when you really start paying attention to the news. I always find it interesting how older people are like, oh, the younger generation, like right now it's millennials, they don't pay attention to anything. I'm like, they're young. Like allow them to be young. Like I feel like sometimes we steal people's innocence too fast. And particularly with Black people, I think we steal Black kids' innocence too fast. And figuring out a way to preserve that, I think, is okay. I'm like a pandemic is something where now millennials are like, oh shoot, this junk is legit. Let me pay attention. And it's not like people are just out on spring break just doing what they're doing and that's the narrative. No, I think people are paying attention. It just sometimes means it's so much information. It's like overload. It's like, what should I pay attention to? What should I be hearing? So to your point, the language in a discourse helps you to say, oh, I heard something like that before. Let me rewind that and listen to it again. So I can actually try to figure out what that means. And then maybe we'll see something on TV and then go look it up, which is what I tell people. Or when you read something about something, don't just stop at that one source. Look up 3 sources and see if they're saying consistent things. And then try to make sure that it's like, okay, I looked up 3 sources. 2 of them is saying A, 1 of them is saying B. The 2 that are saying A, I think that's a bit more credible. So don't just take everything at face value, particularly things on social media and stuff. Like even stuff I'm saying, go look it up. You'll look it up and people actually see that is the stuff that I wrote that they're gonna look up when they use this discourse. But that's important because when you read stuff, you have a broader and a deeper understanding of what's going on.
Yeah, exactly. Well, thank you. Those are all my questions. I appreciate your time. And this was great. And I'm definitely going to send you the footage. And if you want to have the footage, for your own marketing, I'll definitely, give you the full thing. So.
Yeah, that'd be great. I'd love to blast it out. I mean, your stuff is dope. Like what you did with Quran, I was like, oh man, this is like on point. So, he linked us up. I knew it would happen eventually. And, I think this is the topic to do it because people are paying attention. And so, when, whatever you do, you blast it out, you tag me, I'll blast it out. And I'll, when I use the content, I'll definitely blast it out and tag you because, you just do great work. So I'm excited about it.
Thank you. I appreciate it.
Okay. All right. Well, you have a good evening.
All right. You too. We'll be in touch.
Okay. All right. Bye.
Bye.